At the American Association of Suicidology in Baltimore, Professor Mark Kaplan documented the prevalence of alcohol intoxication among American suicide decedents.
Well, one of the theories regarding acute alcohol use and suicide is the role it plays in a form of behavioral disinhibition. That is to say, people who had to become acutely intoxicated before they took their lives. And this is particularly the case with the use of the most lethal means, or what some might refer to as violent means, namely firearms. We see that the proportion of firearms, people died by self-inflicted gunshot wounds, were more likely to be intoxicated than others who used other methods. So I think there's a relationship between particularly young age alcohol use and the use of highly lethal means. And by highly lethal means we mean guns where the over 90% of those who attempt die. Well, there are two messages. One is that clinicians need to probe for alcohol misuse among patients who might be suicidal at one level. At a different level, at the policy level, we also need to be thinking about what can we do from a policy point of view to restrict or limit access to alcohol. And this would be more of a universal approach where we don't identify people at risk. So it might be in the form of primary prevention, but more at the tertiary level or secondary level of prevention. We should be discussing with our clients or patients their possible use of alcohol and other drugs, but I still believe that alcohol is our #1 drug of abuse, and as far as we can tell, a drug that accounts for a large fraction of the suicides involving the highly lethal methods.